Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome to another episode of Healthy Births, Happy Babies. I am Dr. Jay Warren. I am the Family Wellness Chiropractor and the Wellness Care Coordinator here at the Kaplan Wellness Center. And today I am very excited to bring to you a very special guest. She's not only the head of the ICPA, the International Chiropractic Pediatric Association, which is where I began my training in pediatrics and prenatal care over 20 years ago, but her passion for natural childbirth is absolutely contagious, and I have no doubt that it's going to rub off on you here today as well. And that is Dr. Jeanne Ohm. She also is going to be answering some questions about the Webster Technique, what it is and what it isn't, and she really is the authority on the Webster Technique. She trained and certified me 15 years ago when I started as a chiropractor, and if any chiropractor that's been certified in the last 20 years in the Webster Technique, they were trained by Dr. Ohm. So she really is the authority, and she's going to be able to explain exactly what that is and how it might be able to help you in your pregnancy. But before I bring Dr. Ohm on, I want to take a moment to thank our sponsor, the Cap Wellness Center, who makes this podcast possible for you. The Cap Wellness Center in Encinitas, California, has assembled an incredible team of fully certified holistic healthcare practitioners that offer the very best in prenatal and postpartum wellness services. We offer acupuncture, chiropractic, massage, yoga, lactation support services, and a wide variety of birth education classes to ensure that you are fully able to experience the power of birth. And now I'd like to introduce to you Dr. Jeanne Ohm. Dr. Jeanne Ohm has been a practicing chiropractor in a family wellness-based practice since 1981. She is the author of numerous papers on pregnancy, birth, children, and chiropractic, as well as the co-author of several research papers published in major journals. She is an international lecturer on the topic of chiropractic care in pregnancy and infancy, and a postgraduate instructor for numerous chiropractic colleges. She's also the CEO of the International Chiropractic Pediatric Association, the lead instructor of the ICPA's Webster certification program, as well as the executive publisher and editor of the Pathways to Family Wellness magazine. Dr. Ohm is committed to educating practitioners about specific chiropractic techniques and care for pregnancy, birth, and infancy that promotes natural birthing. She's also dedicated to empowering mothers to make informed choices in pregnancy and birth. She's married to Dr. Thomas Ohm, also a chiropractor. They have 6 children together who have all received chiropractic care since conception. They were all born at home, and they are living the chiropractic family wellness lifestyle. Okay, now it's time to turn over to the conversation with Dr. Ohm. But before I do so, I just wanted to tell you there are a couple of times in the audio recording where there were technical difficulties and it garbles for a second or two here and there. I wanted to tell you about that in advance just so you're not too distracted by that. It is well worth it. Her passion comes through despite the quality of those couple of moments there. So with that, let's switch over to my conversation with Dr. Ohm. Dr. Ohm, welcome to the podcast.
Great to be here. Hello, everyone.
Hello. Well, I just want to really thank you for being here today to share your wisdom. We have listened to your bio just now about everything that you're doing as far as with prenatal care and chiropractic, and you're head of the ICPA and an author and a speaker. And I'd like you to share, before we jump into our topics today, a little bit more about yourself, your background, how you got interested in chiropractic, and then especially in prenatal care and babies.
Well, as a kid, I was brought up typically. When I was 19, I went hang gliding, and I actually fractured my spine while I was hang gliding. And I did the typical orthopedic route for a year, the exercises, the PT, the the braces, the drugs, the whole shebang. And after a year of that, I went to his office, and I said, my back still hurts. And he said, you're going to have a bad back for the rest of your life. And I said, well, what? Because I didn't expect that. And I said, no, I'm not. I didn't know what I was going to do. And someone said, go to a chiropractor. They do something with the back. But I went to a chiropractor who really understood the principles of chiropractic beyond just back pain. And what he said is, we're working with the nervous system. And when there's interferences to the nervous system, that affects your whole body's ability to express itself the way it needs to. And, of course, I was in pain and just thinking, fix the back, Mm-hmm. And he started adjusting, and within 3 months, my asthma went away. My allergies got regular. And I said to him, what are you doing? And he said, if you will listen to me on the first visit, we're reducing interference to the nervous system. And that lets you function, all aspects of your being, to function in a better way. And he looked at Tom and I was dating my now husband at the time, and he said, what are you guys doing with your lives, besides jumping off cliffs and gliding? And he goes, Tom, you could be a chiropractor, and Jeannie, you could be the receptionist. And I said, no. If he goes, I go. And we both went to school together. And we were very fortunate that the school that we went to back at that time was very family-oriented. They looked at chiropractic from that perspective, that no matter what age you are, if you have interference to your nervous system, it's going to affect your body's ability to function. It's going to affect the way that you express life. And so in school, we learned how to adjust pregnant moms, children, people 99 years of age, everyone in between. And our skill set was really pretty good. We came out and we opened up a family practice. We had 6 kids, and they were all born at home. And that was us just deducing, well, that makes sense. Because of chiropractic is saying that life expresses intelligence. And that made sense to us. And for us, we concluded from that, wow, natural birth, of course. And don't cut the cord, and stay with the baby and breastfeed as long as they need it. So we made all those choices from understanding that principle that life expresses intelligence. So we had 6 kids, and we had a great family practice going. And I would attend home births as well in the area. I was very connected with the midwives. There weren't even doulas back then, but with the actual midwives and with other moms having home births. And somebody showed me, a patient brought in her video of her son getting born in the hospital. And this was a normal, natural birth. And I saw this excessive pulling happening on the baby's spine. Mm-hmm. And I said, this is over the top. This should not be happening. And here was a child who was born and deemed healthy. He's a healthy APGAR scores 10. But within 2 days after birth, he stopped breathing. Oh. And nobody knew why. So she went back to the neonatal care unit, and they said, and they kept him there, put him on an asthma med. And he was there until he was 2 years of age, and she wound up in our office. And the interesting thing, after several weeks of care, his breathing was restored completely to normal. He got off all medicines, and this was because the pulling on his neck during that birth process created a misalignment in the upper part of his neck and was impairing his breathing. Mm-hmm. So she, of course, was ecstatic. But what I then did was start collecting people's videos. And that's when I kind of went crazy. Oh my gosh, it is about the whole family for sure, but really got to get, connected with the kids. And I became part of the International Chiropractic Pediatric Association. I wound up getting on their board. And then I realized, here was the big aha. If we're going to improve birth for these kids and prevent this type of damage at birth, we need to get to the pregnant moms.
Yeah.
So started looking at the biomechanics of the pelvis and teaching specific techniques to chiropractors that relate to bringing the pelvis into a state of balance so that mom can have an easier, safer birth. And, what I see now is that birth has become this technological experience. And there are certainly times when it is very, very necessary to have that type of intervention. But the problem that I see is that intervention is going to 95% of the population instead of the small 5% that needs it. So, we have medical care or interventive care coming in situations where it's not really necessary and warranted. And that's a big concern. That's something that we need to step back and look at.
Right.
And as moms ready to have babies, practitioners are starting to look at this. If you go ahead and give a major surgery, if, for example, a C-section, in a case where it's not needed, there's a lot of other risk associated with that then.
Right. Well, and it's one of those things, too, where natural birth principles, I don't want to say are coming back because they've never been gone, but places like this and also like all the work you're doing is women are hungry for that. They want to have a more natural birth experience. And, way back when I first started chiropractic school, I went to Life West, which was also a school that taught pediatrics and prenatal care. And it was a talk that I heard you give in the mid-90s around your birth experiences and how excited you were about home birth and how natural it was. And that was a brand new idea for me. Fast forward to just 2 years ago, my son was born at home. We had a home birth with a doula and a midwives, and it was just a beautiful experience. And that it was really, Dr. Ohm, your talk that kind of opened my eyes to that as even being a possibility. And one of the things every time I've heard you speak over the years is that grounding, I don't know if we want to call it a mantra, is, life is intelligent. And really allowing moms and parents to kind of ground themselves with that and then start making decisions from there rather than a fear model.
Absolutely. And what I see is that with all health care in general, what we've lost sight of is normal, natural physiology and the ability of the body to perform and function the way it's designed to, and the ability of the body to heal and regenerate. And because we've lost sight of that and we're so dependent outside of ourselves for someone else to do it for us, that's put women in a state of fear and apprehension about birth. They feel like, I can't do this. I can't do this. Oh, I have to go where somebody's going to, be there to rescue, rather than realizing, honestly, let's look at this. It sounds a little trite, but women have been giving birth for a long time. And, we wouldn't be here as a species if it didn't work. And then, of course, you have the naysayers coming, oh, well, women died in labor. And if you really look at the stats, that was exaggerated. And so for moms, it's hard when you're brought up in a society that's telling you, look outside of you to be rescued, rather than redirect back inside of yourself. I can do this. My body is designed to do this. So what are the action steps I can take prior to conceiving and throughout pregnancy to enhance my body's ability to be able to do this? And obviously, very simply, eat well. And eating well is not, what 90% of the American food is. We've got to really seek out good foods, good organic foods, good grass-fed meats if we're going to eat meat. Just look at good foods. The other factor, of course, where chiropractic comes in, back to the whole thing, if the nervous system is working correctly, if there's no impediment to its function, the rest of the body will function better as well. And that needs 100% nerve supply going to it so it can function the way it needs to. So absolutely chiropractic plays that part to be able to get our bodies working the best that they possibly can. And then the other thing is we don't move enough throughout pregnancy. We're sitting down in chairs, and that's not really the physiological way that humans are supposed to be living. We're supposed to be up and moving all day long. So we sit down and we tilt our pelvis off, and it's out of alignment, and then we expect to just be able to give birth. Birth should be a process where you're up and moving around, and you know, because we've been sitting all our lives, our pelvis is stuck in this posture that's also not conducive for birth. And that also is what we're working with as chiropractors. We're creating balance back in that pelvis, normal motion that should be there, so that during birth, that pelvis can just open right up and allow this baby to come out. And then finally, the last and very important thing is, again, to look back at this fear state. We're not familiar with birth. We haven't seen births as little girls growing up. It used to be all the moms and the girls of the neighborhood go and help that woman through that whole process, and afterwards, and the community comes together. But there isn't that type of community for support. There isn't that exposure for young girls to even see that, birth is normal. At our home births, we had all our kids there. They were present for each one. So my oldest son, in addition to my births, we would bring our kids to other births as well. My two oldest sons, they were comfortable with it. Mm-hmm. Oh, yeah, just in labor again, here we go. And I'm very blessed and happy about this. My sons have all married women who agree with this, and we have 7 grandchildren, and they've all been born at home.
Oh, beautiful.
Yeah. But it comes from that premise of understanding that life is intelligent. And it comes also, and this is huge, moms, this is really big, to trust your intuition, to go inside and to be able to trust and feel and connect with yourself and know that you can do it. So when somebody says, no, you have to do it this way, or you should do it this way, or you're crazy, go inside to your intuition and feel it and trust it. One mom in labor, and this was a grandmother, when I was younger, she was saying, I just knew if I could get up off the bed, this baby would come out. And they wouldn't let me off the bed. They had me strapped down. But inside of me was screaming, if I could just get up and turn around, boom. That was that woman's intuition clashing with technology. And so as women preparing for birth, you have to find your team of supportive providers who are going to respect normal physiology, who are going to do anything they possibly can to help your body work as good as it possibly can. To also get you to redirect from fear back to trust, Yeah. So this key team of providers is huge. A chiropractor, a good birth care provider, a doula who's really going to support you. And what we're seeing with chiropractors, they seem to be kind of like this epicenter, that they're connecting with these people in their community and bringing them together for the women. So that's does my
it's
to choose that and get strong, the better it will be.
Right, and you definitely want to have that external team that creates an environment for that. Natural intuition to be supported, but then that also brings us back to the brain-body connection of the clearer that communication is, the more clearer that intuition will be able to speak up and also be heard.
Absolutely.
Right? And so
our nervous system controls our perception of the environment. And if our nervous system is skewed by these misalignments in the spine, we're going to look at our environment in a skewed way. also, most of us women, living in the Western world, in this society, it's fast-paced, move, quick, boom, boom, boom. We're in this fight-flight kind of mode constantly. The adjustments help take women out of that fight-flight state by strengthening their nervous system to be able to deal with that better. And the more we're out of the fight-flight state, the better off we're able to embrace and have natural, successful births. Yeah.
Right. Yeah, it definitely doesn't remove the external stress, but allows you to adapt to that.
Exactly. Stress. We're not going to remove it. Look at the world. What do you mean I'm not going to drive in a car? Or what do you mean I'm not going to sit at work? Or of course we have to do all those things. We're here.
Right. And that brings us into, I want to ask you some questions about the Webster Technique. I get a lot of questions about Webster. I'm certified in it. I was trained by you. And am I wrong in that you're the only person that trains chiropractors on the Webster Technique?
There might be other people who train it, but the ICPA is the only organization that certifies doctors in it. And it was started by Dr. Larry Webster, who initiated the organization, and he came up with this technique to evaluate the pelvis in a particular way, and so that throughout pregnancy you should be getting adjusted in this particular way, and it would optimize the pelvis so that the baby, would be in a better position, so that the uterus is going to function better, so that there's just greater balance in the pelvis. So this is a technique that really is facilitated throughout pregnancy. Now, what we have observed in instances when moms come in and the baby's in a, unideal position for birth, doctors start working on her pelvis specific with this technique, and we're seeing changes that the babies, because the tension is taken out of the ligaments inside of her, balance is created in the pelvis, these babies are able to get themselves into a much better position in preparation for birth. So anything that can be done throughout pregnancy to prep her body to be able to function like it's designed to is excellent. Webster Technique is big, real big for that.
Yeah. And how would you answer the question of the Webster Technique formerly known as a breech turning technique? It has a reputation, and some people are searching online and saying, I've got a breech baby, I need to go get Webster, which it can help with, but how would you answer that question?
Well, it got termed that way. Larry came up with the technique as a technique to be used throughout pregnancy. It's a chiropractic adjustment. That's what it is. It's not some magical technique. It's a specific way of analyzing the sacrum and a specific way of making correction. And his goal was so that women would have better labors. Just healthier pregnancies, more balance, and a better labor.
Yeah, and the researchers showed that.
Yeah, and the first person who came in was a woman who happened to have a breech baby. And he adjusted her, and back in his day, you could deliver breech, so it really wasn't a big deal. Boom, this baby turns head down. And he was like, wow. And then he started noticing, 95% of the women who came into his office who were breech, they would turn head down. So we're simple-minded people, the world is. His name was Webster, breech babies were turning, boom, that's what it got called. And that was the biggest mistake, because what happens then is that people misunderstand the value of really what's going on. Oh, turn my breech babies. Chiropractors don't do that. They make an adjustment, they restore physiological balance to the pelvis, and the baby does whatever it's going to do. So we're not turning the baby, per se, like an OBGYN would do. That's the practice of obstetrics. We're practicing chiropractic, reducing interference to the nervous system, enhancing normal body function, optimizing the environment. And when you do that, very interesting and amazing things happen with the body.
Right. The body comes into the balance, baby can do what it needs to do and is designed to do. And if the baby's breached, that might be that they go head down.
Right.
And then also, with the Webster Technique, I think what you said is really important, that it is a technique to do throughout pregnancy to prepare the woman's body, one, not just for the labor and delivery and shorten delivery times and decrease pain, but also like optimize the environment for this baby to grow and to be in a start with a leg up, being brought into the world, not only having been developed for those 9 months in an optimal environment, but then also being brought into the world that much easier and safer and natural.
Absolutely. And that's my real goal. It's about the baby. When I saw the horrific procedures to get these babies out, it's just unnecessary. It's just totally unnecessary. If the woman's body is in balance, it's functioning the way it needs to, she's allowed to move around, get into position she needs to, the babies will come out. Yeah.
Well, with our last minutes here, I wanted to have you talk a little bit about your magazine, The Pathways to Family Wellness, and also the movement you're creating with the Pathways Connect meetings around here. Your magazine is fantastic. I have it here. It comes out quarterly. And how did this whole magazine come about?
It was simply supposed to be. It wasn't supposed to be a magazine. It was just supposed to be for chiropractors to have in their practice so that they could share good information relating to that whole concept, life is intelligent, and it came out and chiropractors said, "Oh, I want to buy it in bulk. I want a lot of copies, or my patients want to subscribe." And I was like, "Whoa." So a magazine was created. And right at that time, Mothering Magazine went out of print, which was a loss because that was another great source for parents, to have that particular magazine. And, Pathways really kind of took off. We've received awards and whatnot, which is really exciting. But it is quarterly, and we're addressing all sorts of different issues relating to parenting. But our articles are deep. This isn't like just a light thing of the authors that write there are experts in the field. So we don't have somebody writing a trite article. They've experienced it. They're a practitioner or a mom who's experienced that particular topic. And then we always have articles on pregnancy, birth, a section called outer womb, a section on nutrition, a section on parenting, a section on family wellness. And all of these sections and all of these articles all recognize that life is intelligent. So their article is bringing us into that depth of understanding normal physiology. Life knows what it's doing. And if you make that choice or you have that understanding, you can take this process through and do it with confidence and with ease. So that's what Pathways is about. Now, the Pathways Connect groups was another organic thing that started back in the 90s in our office, and we had a great family practice. But right around the time when I realized, oh, gosh, got to get to the pregnant moms, I realized the big deficit for them was support. And so we started these groups once a month in the office. And when Pathways came around, we instituted Pathways as part of these groups. So you can go to a practitioner's office, and unlike some of the other groups, it doesn't cost the attendees any money to come. You can come once, twice, 100 times. You can bring friends. And the women in there are discussing the different topics in that issue in Pathways. And it's not like a book club where you're, so you'll be in a group with moms, who say, wait a minute, don't give up on breastfeeding yet. I had that same problem and I tried this. Or somebody else saying, I was ready to go into a hospital birth, but then I met somebody here who was at a birth center and that really showed me. And I got my confidence from this mom when she had her VBAC, and I know I can do that. So it's moms coming together, encouraging and supporting each other in the chiropractor's office, and all under that big, broad, major premise that life expresses intelligence. And, they come to understand that principle and see it working within themselves and other people. The trust is regained. And the more trust and respect that we have for that, the less fear. And the less fear, the better our choices are going to be for ourselves and our family.
Exactly. And at the Cap Wellness Center here at the turn of the year, I'll be starting one of these groups simply because of just what you're saying around having, one, a community feel and support for what might seem like different changes. I've found here at the Cap Wellness Center, a lot of the women that we take care of are women that were kind of more medically birth-oriented and are finding here a resource for them to do it a different way. But I'm also finding that after birth, these women are not having as much support as they want, carrying these principles into parenthood rather than it just being a prenatal experience. They're really wanting to have the information, resources, and support to say like, okay, well, how do I carry this further? And we have breastfeeding support groups here led by a lactation consultant, and we have a VBAC support class, and we also have a postpartum class now led by a psychologist. But in a family wellness sense, we want to have this community of, these healthy kids growing up together with like moms, and, maybe play groups come around it, or just being able to come together to have a community really grow.
I noticed with those groups, and Lamaze is amazing, and Leleche League and ICANN chapter is phenomenal, but they stay just specific to their topic. And so you can only talk breastfeeding in there, or you could only talk C-section, or, and what Pathways Connect does is exactly what you said. It can talk about that and the whole parenting relationship we have, and I mean, it just it's so much more fluid with the topics of many things that all women are coming through. So every woman would find multiple topics, but Pathways Connect is still really relevant for her because she's still raising kids and thinking about what type of education to have, or, so it's much more expansive that way.
Right. And I'll include a link in the show notes on this podcast in iTunes, but then also on the website or the webpage we'll be devoting, so women or families can go and subscribe to this amazing magazine if they're not just reading it here in our office. So, Dr. Ohm, with the last couple minutes here, I always like to finish up with two questions, one for the moms and then one for the little babies. And so the first one for the moms, like, what's the take home, the one thing that we talked about here today, or maybe something we didn't yet talk about that you'd really like the moms to be, or the moms listening right now to take to heart?
I'd have to say in this day and age, the biggest thing that we've lost touch with and the biggest thing to reconnect is our intuition. And here's a real visceral way of looking at it. I used to tell my kids when they were little, go right to your solar plexus and pretend that there's fur, like cat's fur right there. Mm-hmm. And when you pet a cat in the direction of the fur, it's very smooth. But when you pet a cat opposite that direction, it's bristly. When you need to make decisions for your family, for yourself, go into that spot. Go into that spot and feel which way is the fur rubbing. And if it's running smooth, you know that's a direction to go in. Trust your intuition. Allow yourself to understand life expresses intelligence, and then use that as a base point for your decisions. So that's the biggest thing that I got from understanding that principle and trusting my intuition with it, that we, had all 6 kids and did what we did with all of them very, very successfully. And we allowed them to express too. So that's for the moms. Get the premise down. You are intelligent. You can do it. Your body knows what it's doing. Respect it. Honor it. Go with it. Listen to what it tells you. Listen to what your gut tells you. It's right all the time.
Beautiful. And what about for the babies? Maybe like a baby that's in utero still, waiting to be born, or here listening. What little pearl of wisdom would you like to whisper into their ear?
Mommy loves you. Mommy loves you more than anything, and is so looking forward to meeting you, to hug you, to kiss you, to be with you. And you know what? Even though sometimes it might seem a little crazy out here, because they experience everything Mom experiences, just know that Mommy loves you. And this is a message for everyone. Einstein said, the greatest decision we will make in our lives is whether we perceive we live in a friendly universe or a hostile one. Sit with that for a while. It's very deep. And so what I want to tell the baby is, it's a friendly universe. Come on out and let's play.
I love that. That's beautiful. Well, Dr. Ohm, this has been a fantastic conversation. Thank you so much for taking the time to share your wisdom and really your passion. Every time I've had the opportunity to listen to you, and this is the first time I've ever had a personal conversation with you, your passion comes through in spades. It's so beautiful and it's so inspiring. And I just want to also give a personal thank you to you that it's really through your guidance and education and mentorship from the very start of my chiropractic career that, fast forward 15 years, I'm able to be here and have an impact on prenatal care and the pregnant moms and bringing these babies into the world that much safer. So thank you very much from the bottom of my heart.
Thank you. Thank you. And it was a pleasure. And many blessings to all of you. Have wonderful births and enjoy.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.